Hi, I'm Angela, a medical surgical telemetry nurse, and someone who's still sitting with a triple-negative breast cancer diagnosis of my own, waiting to start treatment. I used to think I understood what patients meant when they said the diagnosis hit them harder than the disease itself. I didn't. Not really. Not until it was mine. So this video isn't about labs or treatment plans. It's about the emotional side of this. How common it is to struggle, what actually helps, how to talk to the people you love, and when it's time to ask for real support.
First, if you're feeling anxious, numb, angry, or like you can't stop thinking about it, you are not broken, and you are not alone. Research following people through their first year after a cancer diagnosis found about 1 in 5 report clinically significant anxiety, and roughly 1 in 8 experience depression. Other studies estimate that anywhere from a quarter to half of people newly diagnosed with cancer go through some level of psychological distress, and people living with cancer are meaningfully more likely to be diagnosed with a mental health condition than people without it. None of that means something is wrong with you. It means your mind is responding to something genuinely hard.
Here's something I didn't fully appreciate before my own diagnosis. Most cancer centers now screen for emotional distress the same way they check your blood pressure, often with a simple 0 to 10 scale called a distress thermometer, so you don't have to be the one to bring it up first. Beyond that screening, the things that actually help are pretty concrete. Talking with an oncology social worker or counselor, joining a support group with people who get it without you having to explain, journaling to get thoughts out of your head, and simple mindfulness or breathing practices before appointments or scans. None of these fix the diagnosis. They just make it more possible to carry.
If you have kids, this part might be the hardest. About 1 in 5 adults newly diagnosed with cancer has a child under 18, and it's natural to want to protect them from all of it. But the evidence points the other way. Kids who are told the truth in age-appropriate language tend to cope better and feel less anxious over time than kids who sense something is wrong and are left to guess. You don't have to explain everything in one conversation. Start simple. Invite their questions and let them know it's okay to ask again later. The same goes for a partner or close family. Ongoing, honest conversations, not one big talk, tend to hold up best.
So, how do you know when normal worry has crossed into something that needs more support? A few signs worth taking seriously: feeling persistently sad, anxious, or hopeless most of the day for 2 weeks or more, trouble sleeping or eating that isn't explained by treatment, pulling away from people you'd normally lean on, or having thoughts of harming yourself. If any of that sounds familiar, please tell your care team. Asking for a referral to oncology counseling or psychiatry isn't a last resort. It's a normal part of good cancer care, and it's available earlier than most people realize.
As I wait for my own treatment to start, the thing I keep coming back to is this: it's okay to not be okay right now, and support isn't something you have to go find on your own. It's already built into good cancer care. You just have to ask for it. Talk to your care team, lean on the people around you, and be as patient with yourself as you'd be with a patient of your own. Sources and more resources are linked below and on my site. Take care of yourself out there. I'll see you in the next one.